Hello, this is my presentation for Unit 14, Pregnancy and Health. In this presentation, we're going to be having a look into 3 different sections. We have section 1 about gestational diabetes, risk factors, diagnosis, care and care plans. Section 2 is all about preeclampsia, the risk of developing signs and symptoms, care plans and an explanation of eclampsia. And we'll also be looking at issues if preeclampsia is not managed. And then in section 3, we'll be looking at substance misuse. This is risks of consuming alcohol during pregnancy for the pregnant person and the fetus. And we'll also be looking at the impact of illegal substance use during pregnancy and how it affects the baby after birth. Okay, so section 1, we're going to be looking into gestational diabetes. So what is gestational diabetes? Gestational diabetes is a form of diabetes that develops during pregnancy. It develops when the body fails to meet any additional needs of insulin and blood glucose control during pregnancy. This then leads to excessively high blood sugars. Gestational diabetes can both affect the pregnant person and the fetus's health, which is why it is extremely important for it to be diagnosed and managed. Potential risk factors of gestational diabetes. So a higher chance of developing gestational diabetes may be having parents or siblings with diabetes, being over 40 when pregnant, having a BMI of 30 or above, being diagnosed with gestational diabetes before, being diagnosed with PCOS, which is polycystic ovary syndrome, family origin of South Asia, Chinese, South African, Caribbean or Middle Eastern descent, and then previously given birth to a baby which weighed over 4.5 kilograms or 10 pounds. Okay, so some risks for the fetus. A pregnancy of someone who has gestational diabetes may also cause risks to the fetus, which include having a bigger baby, which means a caesarean section may be necessary for a safe delivery for both the baby and the pregnant person. And then also hypoglycemia. This is low blood sugar levels, which could be regularly monitored during and after birth. This is because labour and the cutting of the umbilical cord can alter the baby's blood sugar levels. We also have other risks for the fetus, which include shoulder dystocia. This is when the baby's shoulders get stuck inside the birth canal and the baby struggles to be birthed, causing problems for the health of the baby and the pregnant person. This can also alter the preferred birth plans, as changes may be essential for a safer delivery. And then also additional support postpartum, so additional time in hospital after birth may also be necessary. This may be because of the needs of medication and monitoring for any complications involving the baby and the parent. Okay, so we have some signs and symptoms of gestational diabetes. These include increased thirst, needing to urinate more often than usual, dry mouth, tiredness, blurred vision and genital itching or thrush. Okay, so how is gestational diabetes diagnosed? At the beginning of a pregnancy, around 8 to 12 weeks, you have something that's what's called a booking appointment. This is where you sit down with your midwife and you'll be asked questions to determine any risks, including if the patient has an increased risk for gestational diabetes. And then if the person does show risks, they will be offered a screening test. This screening test involves the oral glucose tolerance test, or the OGTT. Pulse will also be taken. And then after 2 hours of having the OGTT done, bloods will be taken again to check how the patient's body is dealing with the glucose. And then the screening is done again between 24 and 28 weeks gestation. Although if the pregnant person has had gestational diabetes before, they will be offered this screening test earlier within their pregnancy. And then we have care plan. for gestational diabetes. So if a pregnant person is diagnosed with gestational diabetes, they'll need to control their blood sugar levels. They'll be given a blood sugar testing kit. This is so that they can monitor their own blood sugar levels at home. Blood sugar levels can also be handled by change in diet and exercise. If a change in diet and exercise doesn't help their blood sugar levels, they may also be given some medication or insulin injections. The pregnant person will also be closely monitored by their midwife and healthcare team. Okay, so next we have section 2. This is all about preeclampsia. So what is preeclampsia? It is a serious health condition of pregnancy. It occurs when a pregnant person has persistent high blood pressure and proteins within their urine. These complications of preeclampsia can indicate potential organ damage, meaning it needs to be managed appropriately, as it can cause lasting health issues for both the pregnant person and the fetus. Preeclampsia typically occurs when a pregnant person passes the 20 weeks gestation mark. So potential risk factors of preeclampsia are existing medical issues. So this could be diabetes, kidney disease, high blood pressure, lupus, or antiphospholipid syndrome. Also previously had preeclampsia before, being 40 or over, a pregnancy of multiples, so twins, triplets, etc. A BMI of 35 or higher, history of preeclampsia within the family, previous premature birth, and having a 10-year or longer gap in between each pregnancy. Okay, so some risks for the fetus. Because the preeclampsia affects the normal function of the placenta during pregnancy, some risk factors that could affect the fetus include preterm birth, infant death, stillbirth if placental abruption occurs, and lack of oxygen and nutrients causing lack of fetal growth. Okay, so we have some signs and symptoms of preeclampsia. Early symptoms and signs include high blood pressure, which is hypertension, or the protein in the urine, or proteinuria. And then further symptoms include severe headaches, vision problems, so blurred vision, seeing flashing lights, pain below the ribs, vomiting, and sudden swelling of the feet, ankles, face and hands. Okay, so how is preeclampsia diagnosed? Preeclampsia will be diagnosed through routine checkups throughout the pregnancy. This is probably done by the midwife in the appointments. Blood pressure and urine dip tests are done regularly at these appointments, so midwives will be able to spot signs of preeclampsia. If a midwife suspects preeclampsia, blood tests can be done between 20 and 36 weeks plus 6 weeks gestation. If preeclampsia is diagnosed, the pregnant person will be referred to a specialist within a hospital where they will have further tests and be monitored more. Okay, so care plans for preeclampsia. Preeclampsia can only be cured by having the baby delivered. This means a pregnant person with preeclampsia will need to be closely monitored until it is safe to deliver the baby. If monitored in hospital, this would include regular blood pressure checks, urine samples taken, various blood tests, ultrasound scans to check on the blood flow through the placenta, and monitoring of the baby's heart rate using cardiotography. Medicine to lower blood pressure may also be recommended, and delivering the baby early may also be recommended. This can happen around the 37-week mark. This can also be done through an induction or a C-section. Although if the preeclampsia becomes really severe, delivery before 37 weeks may be necessary in some cases. Okay, then we've also got eclampsia. We'll be looking at the potential issues that could occur if preeclampsia is not managed. So what is eclampsia? Eclampsia is a rare but serious complication of pregnancy that causes seizures. Someone who is suffering from preeclampsia could develop eclampsia if preeclampsia is not properly managed. Eclampsia affects less than 3% of people with preeclampsia. Seizures from eclampsia can cause confusion, disorientation, and can even put the pregnant person into a coma. Eclampsia will be diagnosed through presentation of seizures in the pregnant person with preeclampsia. Tests can also be done to identify and confirm eclampsia, including creatinine testing, urine testing, and blood testing. And then these are the possible warning signs of eclampsia on this little photo, which is the severe headaches, difficulty breathing, nausea and vomiting, trouble urinating, abdominal pain, blurred vision, seeing double or loss of vision, and swelling of the hands, feet and ankles and face. Okay, so some complications of eclampsia. If preeclampsia is not managed properly, it may develop into eclampsia, which can cause damage to the organs, the kidneys and liver. Hemolysis, elevated liver enzyme and low platelet count, cardiovascular disease, stroke, after birth bleeding. Also, if preeclampsia is not properly managed, it can affect the unborn fetus, which would be a lack of blood and oxygen, restricted growth and limited nutrition. Okay, so then we're going to go into section 3, which is around alcohol and drug use within the pregnancy. Okay, so alcohol consumption during pregnancy. When a person becomes pregnant, it is recommended for them to stop drinking alcohol for the duration of the whole pregnancy. This is because drinking alcohol can affect the healthy growth and development of the fetus. It can also cause long-term complications during and after birth. So some risks during pregnancy. If a person consumes alcohol during pregnancy, it can cause many risks, including premature labour, fetal alcohol spectrum disorder or FASD, small for gestational age, SGA, damage to the fetus's internal organs and respiratory system, miscarriage or stillbirth, low birth weight, or higher chances of illnesses during early development stages and childhood. Okay, so one of the disorders that can be developed from consuming alcohol in pregnancy is fetal alcohol spectrum disorder. This is a disorder which occurs when alcohol in the pregnant person's blood passes through to the placenta, affecting the fetus. Some characteristics of FASD include problems with movement, balance, vision and hearing, problems of learning, thinking skills, concentration and memory, problems managing emotion and developing social skills, hyperactivity and impulse control, issues with the joints, muscles, bones and organs, kidney and heart for example. And then here we have some characteristics of the facial things. So we have low nasal bridge, we have short nose, minor ear abnormalities, flat mid-face, thin upper lip, flat or absent groove in the upper lip and a receding jaw. We also have preterm labour, which could be an effect. This is classed as a birth happening before 37 weeks gestation. Drinking alcohol during pregnancy increases the chances of having a preterm labour or preterm birth. This means further complications can occur for both the pregnant person and the fetus. Drinking alcohol during pregnancy also increases the chances of miscarriage, stillbirth and sudden infant death syndrome, also known as SIDS. We also have small for gestational age or SGA. This is a complication which involves the growth of the fetus within the womb. This is identified through growth charts when the fetus is not meeting the expected growth measurements. Fetal growth is assessed through head circumference, abdominal circumference, femur length, amniotic fluid measurements and blood flow. So, and then it says SGA can also lead to increased risk of stillbirth, miscarriage and preterm labour. So they'll be monitored on what's called a growth chart, and if they're not meeting the appropriate for gestational age, which is this line, and they're going more on this line, then they may be diagnosed with their small for gestational age, which could be a concern. Okay, so illegal substance use within pregnancy. Once a person becomes pregnant, it is advised to stop all forms of drug use if applicable. There is no form of illegal or recreational drug that can be taken during pregnancy that doesn't risk run the risk of harming the fetus or the pregnant person's health. Support for the pregnant person is available if needed. The impact of illegal drug use. If a pregnant person uses illegal drugs whilst pregnant, there can be multiple complications after birth for the baby, and this includes impaired growth, birth defects, altered brain development. Prenatal drug use may also impact a child's behaviour, language, cognition and achievement long term. Drug use during pregnancy can also lead to miscarriage or preterm labour, stillbirth and an underweight delivery. So some examples of drugs and their effects during and after a pregnancy and birth. We have cocaine and methamphetamine. This runs the risk of placental abruption and premature membrane rupturing. Ecstasy or MDMA runs the risk of birth defects and motor developmental issues. Heroin runs the risk of withdrawal symptoms suffered by the baby after birth, and sudden infant death syndrome and vaginal bleeding. And then cannabis has the risks of premature birth and low birth weight. So we have neonatal abstinence syndrome. If a pregnant person uses illegal drugs throughout their pregnancy, then their baby will be born with a condition called neonatal abstinence syndrome. Some symptoms caused by this include excessive crying, high-pitched crying, irritability, trouble sleeping, excessive sucking, poor feeding, slow weight gain, diarrhea, vomiting, fever, blotchy skin, sweating, quick breathing, stuffy nose or sneezing, hyperactive reflexes, increased muscle tone and trembling and seizures. Drug abuse during pregnancy, some help available. So there are plenty of resources and help for a pregnant person if they're using illegal drugs. It is important for them to seek help straight away. So they can get help from their midwife, the GP, and there is also some drug treatment services. And then some other services available is Frank. This is a helpline that operates 24/7 for any advice. And Tommy's. This charity also has lots of information on illegal drugs and pregnancy, etc. Okay, so that's my presentation. Thank you for listening.